So what can we expect this fall and winter 2020 to 2021 season with things like respiratory illness and COVID-19? And how long will we have to wear masks for?
Well, great questions. There are a lot of unknowns. What we can do is look historically at what happens in Ontario for respiratory viruses. Historically, at the beginning of September, we start to see rhinovirus peaking. And it causes fever, chills, muscle aches, and joint aches, and significant sinus pressure and sinus headaches. After around 6 weeks, its numbers decrease, and we start to see the beginning of influenza. And traditionally, it's influenza A, which starts in November and starts towards peaking around the holiday season. So sometime around the mid-January, it peaks in its activity. And influenza has a significant impact on the very young, the very old, admissions to hospital, visits to emergency departments, and it has significant mortality associated with it as well. If it's an unusual or different influenza season, we'll see a late peak in influenza B, and that typically would happen in February and March. Throughout this, we also have other coronaviruses and other influenza-like viruses called parainfluenza, which can cause illnesses like croup for parainfluenza and or the common cold. So we've got a whole group of viruses that are going to mimic COVID-19 in the fall. What would be beneficial to our schools, to our businesses, our employers, is really if we could decrease the impact of all of these viruses, because they will confuse clinicians. We'll have to test for COVID-19. We won't have community testing for all these other viruses. If we can suppress them all, I think we'd all feel more confident going forward, and there would be decreased need for people getting assessed and tested, and decreased impact on the healthcare system. What worries me the most is if COVID-19 came back during the fall and winter respiratory season, and we had a double impact of COVID-19 and influenza at the same time. Because this, we already know, has a significant impact on the acute care sector. With the addition of COVID-19, it could double or triple the impact and really cause our hospitals to get burdened significantly. So, going forward, we anticipate that we'll need to have mandatory masking throughout this winter respiratory season to have multiple benefits to our community, to keep our schools open, to keep our economy open, and to protect our healthcare system against a double hit of both influenza and COVID-19. So we anticipate masking being mandatory till we're through this year, and or we have a safe or effective vaccine or a safe and effective treatment for COVID-19. But we anticipate that won't be available to at least the summer of 2021.